we will turn it over to Dr. Peter Kilmarks for the first presentation. Peter is going to talk about the global and U.S. epidemiology and public health mitigation situation. Then we'll follow up with Dr. Haley Merriam talking about the clinical and treatment issues going on and the local DC case situation. And then finally with Dr. Lucy on the vaccine development and rollout. Very interesting subject. So go ahead, Peter.
Thank you, Bob, and thank you, Grace, for the introduction. I just want to say how much I appreciate being part of the Bridges program and being able to keep in touch with the next generation of Dartmouth grads that are interested in social service. And it's really a wonderful thing that Bob has going and the people I've been able to interact with. So I'm going to give an update on coronavirus 2019 and the epidemiology and public health response issues. So I'm sort of the bad cop and with the bad news, and Dan gets to on the vaccine. So this is the global picture, and on the left is the countries that it's in descending order by the number of new cases yesterday, and we can see the global total is now at over 69 million, and the number of new cases yesterday was 650,000, and the number of deaths, total deaths, is sadly over 1.5 million globally. And then this is ranked by the numbers of new cases yesterday. So it's the US, Brazil, Turkey, India, and then a number of European countries. And we can see here on the right, this is the number of new cases per day has been over 600,000 per day. So really very intense, high level of global transmission. And then the reported deaths per day, this is now at about 12,000 deaths from COVID-19 per day worldwide. And just looking not at the total numbers, but at the rates, so with the denominator, the number of average daily cases per 100,000 in the past week, this dark purple is over 68 per 100,000 per day. And it's the US, and then it's really Europe and Eastern Europe where there's the highest transmission on a global basis. Earlier it was very intense in South America, and that's now somewhat lessened. And then looking at the US, and note on the last slide, the purple was over 68 per 100,000. This is now, purple is over 250 per 100,000. And I'm kind of struggling to how to describe this map. In the spring, it was more so in the Northeast. In the summer, it was more so across the South. And now it's been very intense in the Midwest and upper Midwest, but it's really, maybe except for Vermont and Maine, yeah. It's hard to say there's a state that's not having a pretty intense transmission. Earlier, healthcare workers were able to go from one state to another, but we're not in that situation where we can have that kind of task shifting. And so this gives just a snapshot of where we are in terms of, let me walk through this. So cases, we can see this was the spring wave and the summer wave, and now we're way beyond that. We're now well over 200,000 cases per day. So this winter wave, this third wave is far beyond what we'd seen earlier. And then in currently hospitalized, we had a lot in the spring, we had a lot in the summer, up to 600,000 hospitalized. We're now way beyond that. And I just note these single day records, these red dots. This is a record number hospitalized, the average daily cases in the last week. And then most tragically, the deaths. We had that spring wave in the Northeast, New York, of over 2,000 deaths per day. The summer was less so as the case fatality was lower, but now we're back. We've had over 3,000 cases yesterday. So we're really coming into a very difficult period with this. And then back over here on the left with the testing. So this is good that this is going up. But unfortunately, some experts had said we should really have in the 3 to 5 million tests per day neighborhood to be able to really get a handle on this and identify cases and have adequate isolation and contact tracing. So it's good that the testing has continued to go up, but it's still not where we need to be, unfortunately, in the numbers of tests per day. And then a particular tragic aspect to this, this was in the New York Times yesterday, this story that there's no place for them to go, the ICU bed capacity across the country. And you can see it's not any one region, it's really in many states across the country. The note here is that 1 in 10 Americans across the Midwest, South, and Southwest live in an area where the intensive care beds are either completely full or fewer than 5% of these beds are available. And this is where we get into this, where it's hard to maintain the existing standards for care. And we're talking about crisis care or basically rationing care. And a real rate limiting step as part of that is there may be a bed or a ventilator, but having the trained staff, having the nurses, the critical care nurses, physicians, respiratory therapists to actually provide that care where it is in this difficult period where this is really stressed and overstretched. These are the projections from the University of Washington, the the Institute for Health Metrics and Evaluation, and they've been quite prominent in their forecasting. So this is the number of deaths per day, and this was the spring, this was the summer, and where we are now, where the average is about 2,200 deaths per day. What they're forecasting, and they've been quite reliable, is reaching nearly an average of nearly 3,000 per day in January. And they note a couple of different, so this is their base case scenario. If there was further mitigation or further easing of mandates and less restrictions, we could go up to as high as 6,000 per day. And if there were universal masking or an increase in masking, we'd pretty soon see a decline in the transmission and the deaths. And then they have a couple scenarios here for the vaccine rollout. So this increases because of the easing of the mandates and the increased mobility with that, and then the seasonality of COVID-19. And what they're forecasting is that by April, we'd have over 500,000 COVID-19 deaths, which is an additional 245,000 from where we are now. So we're at the beginning of a difficult period, or we're in a difficult period at this juncture. One troubling aspect has been the racial ethnic disparities in the hospitalizations and deaths from COVID-19. And you can see here that compared to white non-Hispanic persons, the cases, hospitalizations, and deaths are substantially higher. The rates in American Indians and Alaska Natives, Blacks or African Americans, and Hispanics or Latino persons. So about 4-fold higher in the hospitalization rates and 2.5 to nearly 3-fold higher in terms of the death rates in these racial ethnic minorities. And that's thought to be because of socioeconomic status, access to healthcare, and then exposures related to occupation, and an element of health effects of discrimination. The CDC has recently really put out a nice guidance in terms of what we can do to mitigate the transmission and to try to improve the situation. Wearing masks, upper left corner, wearing masks, and I'll say more about that. Maintaining distance and limiting contacts, avoiding gatherings, identifying and isolating cases. So this is where the testing and identifying cases and having people who test positive isolate themselves, protecting high-risk groups, the elderly, those in long-term care centers or nursing homes. I can say more about that, including my father, class of 50 situation. Protecting healthcare workers, we could talk more about that, and really the tragic impact on healthcare workers in terms of what's happening with them with cases and disproportionate deaths in that group. Conducting contact tracing and quarantine. So people who are contacts of cases should be quarantined. I've been doing a lot of work here and can say more about that. Postponing travel. I wish my son in Oregon were coming for Christmas, but that's not happening. And so I'm not going to see him this year and not until middle of next year. And then hand washing, as always. And Dan's going to be able to talk about vaccinating widely is now this new intervention, although before most of us have access to this. And then these very positive outcomes that will come from these interventions. Another way to conceptualize this is the Swiss cheese respiratory virus pandemic defense, and really highlighting how these interventions aren't perfect, and any one of them might let some virus through, but it's the layering. So when you take the Swiss cheese out of the package, you've got to switch the pieces around so the holes don't line up. But these personal responsibilities are distancing and masking and hand hygiene, and limiting time in crowded situations. And then the shared responsibilities, the public health response, is the testing and tracing, better ventilation, government messaging and financial support, providing resources so people who are infected or exposed can quarantine or isolate, and finally vaccines. So taken together with all these layers of Swiss cheese, although none of them are perfect, they will block the virus from infecting us. Bob asked me to say more about masks, and this is a recently updated guidance from the CDC, and noting that about half of new infections are from people who are asymptomatic. So it really highlights the importance of universal mask use, and that these cloth face masks, they're beneficial primarily for source control. So if someone's infected and maybe asymptomatic, up to 80% of their respiratory droplets will be blocked in what they're exhaling or coughing. And then to a lesser extent, there's also some element of protection for the wearer to prevent them from inhaling the droplets. So the CDC recommends these non-valved multi-layer cloth masks or just non-medical disposable masks for community use, and that face masks are most important for indoor spaces and outdoors when distance can't be maintained. And some more data behind that. Their website has a long list of these studies, but I just pulled out a handful here. So one report was of two hairstylists with COVID-19. They interacted as hairstylists for about 15 minutes with a large number of clients, both them and the clients wearing the masks. And none of their clients who were tested developed infection, so that was strong evidence of protection. In another study of 124 households, if there was mask use by the index patient with COVID-19 and their family members, this reduced the transmission by 79%. In community studies, in 7 studies, when there was universal masking, the new infections fell significantly. In 3 of these, they showed actually a decreased mortality. So mask use saving lives. In particular, a study in Kansas, the statewide executive order left it to the counties. It was sort of an opt-in mandate at the county level. So in the 24 counties that went ahead with the mask use, with the mask mandate, the COVID-19 transmission decreased by 6%. And in contrast, the counties that didn't take on the mandate, the COVID-19 rate increased 100%, so double. So very strong evidence of the importance of mask use and mask mandates. And then with this, if there was an increase in the mask use, there would be great, we'd actually could prevent the need for lockdowns with a great financial economic benefit. So just the last couple of slides, just to emphasize, I said this earlier, the importance, I think for us especially as Dartmouth graduates, as community leaders, to stay informed, to beware of misinformation. Don't be the person who passes on fake news. As Dr. Tedros, the WHO Director General said, we're fighting an infodemic. There's some nice guidance here about what to do if you do see misinformation in your interactions or social media. You ignore it, you can block the person, you could message them privately to correct it or have them correct it. You can report them on some social media platforms. You can actually have the misinformation blocked, and then really take a role at us, I think, as community leaders to be spreading the correct official advice. And this is especially concerning now that we have a vaccine. There's been so much already vaccine misinformation and vaccine hesitancy that it's really incumbent on us to provide the correct information about. We now have a approved, safe, emergency authorized, safe and effective COVID-19 vaccine, and more to follow. Also, just to emphasize the mental health aspects of this has really been a marathon. When we last met in April, we were 1 month into it. Now I hope we're past the halfway point, but only just past the halfway point. It's going to be months before most of us have access to a vaccine. So to emphasize the need to take care of yourself, take a break, take care of your body, unwind. This is my wife, Nietzsche, who's listening, and me playing Kadima to keep ourselves busy and taking a break. And then just some guidance here. If stress is really getting in the way of someone's daily activities for several days in a row, they should be seeking help from their healthcare provider or the resources here. And I've shared these slides, and we can make them available to maybe Bob or can help to get them out. So just to summarize, we're seeing, unfortunately, this dark period of increasing infections globally and in the US, that the healthcare capacity is overwhelmed in some jurisdictions. The US fatalities projected to increase to over 500,000 by April. This terrible problem with the racial ethnic disparities, really uncovering some of the longstanding challenges in this country. We do have multiple effective interventions, including the masks. The vaccine is here, but as Dr. Fauci said, things will start to get really bad in January, and this is a dark time for us. So please be smart, be the person with the right information, take care of yourself and your family, your community, and thanks again to Bob for this opportunity. And I will stop sharing.